Well, good morning, everyone. It is great to see you this morning. Thank you guys so much for joining us for Von Willebrand's conference. We have been looking forward to this for quite a while, and a lot of really exciting things are happening for this part of our bleeding disorders community. I am here to share some insights with you, to talk a little bit about living from unheard to unstoppable, harnessing the lived experience to prevent joint disease in von Willebrand's disease. So I'm excited about this session because there's a lot of things that I'm looking forward to talking about that I think is pertinent to where we are in the von Willebrand's community today. A lot of revelation has occurred, I think, for this segment of our community. And I want to start out by giving you some kind of high level, just kind of 30,000 foot view. Full disclosure, I am a person living with hemophilia A, and I've had to really educate myself to learn more about von Willebrand's disease. It's funny how you can live with something and be such an expert because you're living with it. We oftentimes say in rare disease of any kind that the patient is the most expert person in the conversation because you're living with it day in and day out. And so that's very true. And I think that, but as an organization, it's been important to us to serve all types of bleeding disorders in whatever capacity that we can. And so we work with and help a lot of families with von Willebrand's disease. So this has been near and dear to our hearts for a long time, and we're excited to talk about it today. Full disclosure, though, I wanted to let you know that I am not a doctor. So just in case there's any mystery or confusion, I'm not actually a physician. So this presentation is not intended to give medical advice or to give you any specifics of treatment for your personal care. We're here just to encourage you, build you up, and give you the tools you need to be able to have a more educated conversation with your physician and treatment plan so that you can ask more questions. And I think it's really, really important that you're here so that you can learn as much as you can about context. But please don't take anything you hear today as personal direction to give you guidance on your personalized treatment. We're just here to give you tools so that you can go and seek advice from your doctor for your personalized treatment. So I want to talk a little bit at a high level of what is von Willebrand's disease, how many people are affected. A lot of people don't know this in the bleeding disorders community, but von Willebrand's disease is actually technically, by the math, not really a rare disease. It would not qualify for a rare disease status if it went by the estimated numbers. So the estimated numbers that the CDC believes is upwards of maybe 1%. There's even other research that's been done that says that there's suspicions that it could be even broader than that. I've heard numbers of 2 to 3% even in some cases. But essentially, if it was 1% of the United States population, over 300 million people, you'd see about 3 million people affected with von Willebrand's disease. And the crazy thing, the really wild thing about von Willebrand's disease estimates, though, is that only about 30,000 people of these people are being treated regularly at an HTC. Now, that is such a huge gap. This is one thing that is very distinctly different about von Willebrand's disease as it is to many other rare diseases or even specifically other bleeding disorders. But this is something that we think requires a lot of education. It needs education from every aspect of the community, from the physicians to the clinicians that are just maybe even your primary care doctors. All of those folks need education, but also we believe that public awareness is super important. One of the reasons why we do moments like this is so that we can also educate the public, so that we have an opportunity to be able to hopefully bring awareness to the disease, because we believe that there's a lot of people out there, potentially millions of people, that are really suffering unnecessarily, that they could have treatment and have a much higher quality of life, but they don't because they don't know. And so you've heard the old adage that knowledge is power. And truly, in this case, you could be in a lot of suffering, experiencing suffering, and not even realize that the reason behind your suffering is because of von Willebrand's disease. And so roughly, this is some other interesting facts that I find fascinating, is that 27 years old is the average median age of diagnosis. Now, part of the reason for this is because you have a really, really extreme and broad variance of the age of diagnosis with von Willebrand's disease. And you can see that kind of reflected in the population, which what is being managed versus what is actually estimated to be. So you have some folks that I was talking to someone the other day that was like 65 years old, they just gotten diagnosed. I've talked to some people that were 45 years old just getting diagnosed and have suffered their whole lives with this, but did not realize that there were solutions out there, or even have a proper diagnosis. So average age is 27, which just goes to show you that a lot of folks are not being diagnosed right at birth like they are in certain other disease states. I would say the other part of that reason sometimes has to do with the wide variance of severity, and we'll get into that a little bit in a minute. But the average age, or the average years it takes to diagnose is also 16 years. And that's really from, severe symptoms. So people might find themselves in the hospital, or they might find themselves with, extended nosebleeds or dental problems that literally are so, it's kind of a crisis and nobody knows what to do. And there's people are cauterizing stuff and people are trying to do all kinds of solutions, but it can take a long time to actually acquire diagnosis, even if you're experiencing symptoms. So, part of the reason, again, we're doing this session and many others today is because we believe that it's important for more education to occur so that more people can get awareness so that they know that this exists and that maybe they should investigate further. A couple other fun facts that I think are interesting is that it affects both men and women equally. The reason I wanted to highlight this fact is because there is a lot of confusion, even among specialists, that sometimes women are the only ones that can be affected by von Willebrand's disease. There's a lot of misinformation out there that says that men can have it, women can't have it. I talked to a lady recently that was saying that in her experience, that the doctors would always tell her no, she couldn't have von Willebrand's disease, and it was clear that his information was kind of coming from maybe a hemophilia background or something like that from a textbook, which we still have sort of debunked that as well, but that men and women both can have hemophilia too. But in essence, this is something that is, very common, that misconception that both men and women can have von Willebrand's equally. So, who are the people that are uh, getting these diagnoses? Where are they getting them diagnosed at? I think this is kind of some interesting statistics here. And I've put my source information at the bottom of this slide so you can see where it came from. Also, a little QR code if that helps you to be able to go and look up this in some research. There's far, far more details and information in the research. I think is very valuable. But according to the research, it shows that 42% were diagnosed by a hematologist. That seems to make a lot of sense. I'm kind of surprised it's not higher than that, though. And you can see the breakdown a little further below is 28% by an internist or a family doctor. And 19% by a gynecologist. So interestingly enough, if you figure that 50% of people living with von Willebrand's are female and 50% are male, 19% is a pretty high number. That's almost half of women, because men mostly are not going to gynecologists. So you have almost half are being diagnosed by their gynecologist. Interesting fun fact. This is bonus material. So if you're taking notes, you can you can. I feel like I'm on a radio show today. I think I have a little drip in my throat or something, and I feel like my throat's like not right. But anyway, but there's a like, are we doing a game show or what? Anyway, there's interestingly enough, though, we have a retired OBGYN who is on our board of directors. And one of the ways that he came to us, Dr. Bivin von Allman, he's actually done a podcast with me recently on women with bleeding disorders. Fantastic podcast. And shameless plug, I'd encourage you to go and watch that podcast on our YouTube or listen to it on Spotify or iHeartRadio, wherever you get your podcast material. It's a great episode. Actually, I think it's still one of the highest downloaded episodes of all of our podcast episodes. But in his episode, he actually talked a good bit about this. But the reason why he is he got involved with our board of directors was because he was seeing bleeding disorders so commonly in his practice and surgeries with women not clotting properly. And he just did his own research and realized that, oh my gosh, bleeding disorders are more common than people think. And he was diagnosing bleeding disorders so commonly that he wanted to get involved in the community. So we're really, really privileged to have him on our board. So, moving along, I want to I'm kind of buzzing through some of these facts quickly for two reasons. One is I assume that many of you already know some of this, so I'm trying not to belabor this too much, but also I have some really interesting things that I really want to get to. And so I'm kind of giving you highlights and going through some of this data, but feel free to screenshot any of this material if you'd like and take notes if you can. Pop quiz. Does anybody know what year von Willebrand was first discovered in research? I've got some cheat notes on the screen if you'd like to look in that and write that down. But it's 1926 by a physician. And people ask sometimes, we get questions all the time in our email and Facebook and, social media and all these things. Sometimes like, why is it called von Willebrand? It's such a funny name. It's a bleeding disorder. It's kind of different than some. Well, actually, the guy that discovered it was Eric Adolf von Willebrand. And he actually made the discovery in 1926 and some fascinating information in his research. But this is kind of a breakdown of where all the different types were. Another pop quiz question. How many types of von Willebrands are there? A lot of people say three, and you would be correct in assuming that because type 1, 2, and 3. But you can see here on this chart that it kind of breaks down. There's actually 6 different variants. And this gives you an idea that there was a limitation in Dr. Von Willebrand's material that he was really observing from, outward bleeding. He was observing from the commonalities between patients he had, but he didn't have the ability to look at the molecular level to really understand what was going on. And so that didn't start to extrapolate other types until much later. And that's where we get really in the 70s and 80s. There was a lot of molecular level discovery going on. But that's where we get type 2A, B, M, N, and so on. So in Dr. I keep wanting to say von Allman, which is our board member. He didn't discover it. But in Dr. von Willebrand's initial discoveries, he actually had mention of different severities from mild to severe. And he kind of had this he alluded to that there might be a different type and a different cause. So that's where there was some material later on that was referenced from his research that showed type 1 and 3. But it was essentially similarly, if you're familiar with hemophilia, and there's many people, but by the way, there's many people that are diagnosed with both hemophilia and von Willebrand's disease, interestingly enough, but von Willebrand is its own factor and its own protein. So interestingly enough, when all of this was being discovered, it's since we've grown in our research and information and the data available to us and the ability to research this stuff at a molecular level, it's almost an oversimplification now to say that there's type 1 is mild and type 3 is severe. What we're learning in real time in the last probably decade or so is that you can have type 1 that is still very severe. They bleed like severe. And so some of you may have that. There's also people who are type 3 that are severe out from the gate. And oftentimes the diagnoses on type 3 von Willebrands are diagnosed much faster because they're having more frequent emergencies that require therapy. So this just gives you an interesting kind of breakdown of the timeline a little bit of when these things were discovered. And I have to say, just in working with the bleeding disorders community, we really had not seen 10 years, 20 years ago. We just didn't see a lot of folks that were being actively diagnosed with type 2M like Mary or type 2N like Nancy. We were seeing people diagnosed with just type 2, or type 3. And there's a lot of dismissal in the von Willebrand's world, that you can't have this type of bleed or you can't have that type of bleed. So that really leads me to the core reason why we're having this conversation today, and that is to ask some questions around that. Many people know that there's mucosal bleeding. There's there is from soft tissue. You can have sometimes muscle bleeding, but one of the core principles that I wanted to really focus on this morning is it possible to have joint bleeding in von Willebrand's disease? Can people with von Willebrand's disease experience joint bleeding? I think if you did a survey among physicians what you would likely hear from many, many treaters, and maybe not hemophilia specialists, so maybe not HCCs who are, I'm going to exclude that group for a minute. But if you just talk to, again, we see that there's a lot of folks, primary care, as well as gynecologists, that are treating people with von Willebrand's. If they were if they were the ones treating you in an emergency room setting and you didn't have an HTC yet, which, by the way, we believe that HCC is the best place to get treated. We've had many people come to these things that we're investigating, and they didn't know HCCs exist. So HCC stands for Hemophilia Treatment Center, and there's some great. We have links on our website. We can send you a list of a hemophilia treatment center in your area. Those are the best places to get the most expert advice and treatment. But let's just say, assume that you've got more than 40% of diagnoses happening at a non-specialist environment, and so if that's the case, there's many folks that are presented with a joint bleed that can't, a limitation in movement and extreme pain, and they don't really. It's sometimes it's just dismissed and saying, "Well, you can't have that if you have von Willebrand's disease." So I think the research is contrary to that, and you can see in the comments right now there is so many people saying, "Absolutely, you can have joint bleeds all day long. It's absolutely possible." All this stuff. So you can see just from the people that are living with this is something that people know about. But the research is a little bit vague and not very thorough. But we'll speak to some of this research. You can see this QR code here if you want to scan to learn more. But there is roughly documented about 25% of patients have self-reported in one study that joint bleeds, that they had joint bleeds at some time in their life. Now, interestingly enough, 50% of patients with type 3 said that they had had joint bleeds. So joint bleeds, definitely there's a higher occurrence happening in type 3. But we have patients that are reporting with type 2N, type 2M, type 2, type 1, even occasionally that you see where they're having joint bleeds. So I would say the resounding, the data shows, the data reflects that not only you can have joint bleeds, but it does happen more frequently than I think a lot of sort of the lore, as my teenage kids like to tell me. That's the new word, is lore. Give me the lore. But yeah, there's a sense of this, that is limited to, some people kind of dismiss it, but this is the real data. This is what people are saying. And another statement that I like, and I found this in one of the research projects, and I really feel like this sums it up really well. This is for people who have experienced joint bleeds. Joint bleeds are possible. One of the things that I hope that you can get from this today is that self-reporting is a huge driver in getting the right diagnosis and getting the right information, and also getting the right feedback from your doctor, getting the right treatment, right? And that's true whether it's in the emergency room or whether or not you're on a ongoing care scenario. Hopefully you're getting your treatment from a treatment center and getting expert care. But in that sense, there is a real probability that if you've experienced a bleed, then you've already proven it's possible. And so you have to be bold about explaining that and explaining what's going on when you're in your clinic visit, because that is the only way that they're going to know. So if you've had bleeds like this before, it's 100% possible for you. Across the broad scope, maybe there's only a certain percentage that experience them. But if you've had a joint bleed or suspicious that you had a joint bleed, it is absolutely possible for you to have a joint bleed. So what happens when joint bleeds occur? I think that this is something that is also important to reflect on, because obviously there's pain, there's pressure, it's very uncomfortable, it's very disrupting to your lifestyle, all of those things. But I do want to highlight this one fact, and again, you can find this in the research on the QR code that I've displayed here. But 40% of von Willebrand's with documented joint bleeds develop arthropathy. And this is something that's very commonly known for hemophilia. But again, there's a lot of misinformation and lack of education, out there about this. And I think it's important for us to be aware of the fact that severe arthritis can develop over long periods of time, and that's something that can be avoided with prevention. But you got to start early, and you've got to be aggressive in your prevention. So how do you avoid arthropathy? How do you avoid crippling arthritis over a long period of time in your joints? Prevention. I think that prevention is probably the only way to prevent it. Arthritis is common to aging. It's not something that's only common to bleeding disorders. There's lots of reasons why arthritis sets in. But if you have suspicion that you've had unusual activity in your joints, you need to speak up. You need to say something. And I think it's going to be incumbent upon us as individuals to be able to advocate for ourselves, to share that these things can occur. So let's talk about a little bit of the benefits of being proactive versus reactive. So what are I think a lot of this may be common sense, but I think it's important to speak to the elephant in the room because I know for me, I need a reminder. I was actually, full confession here, I was actually in my office yesterday, and it was time for me to take my factor, and I brought my factor in and set it on the conference room table, and then I had a meeting that came in a little early, and it just so happened to be a hematologist that came in to visit, and she was here, and she was like, and we've been friends for a long time. She goes, do you want to take that before we start our meeting? And I was like, oh, no, it's okay. I'll take it a little bit, just an hour or so, won't be a big deal. Well, anyway, our conversation ended up being very extended. And so by lunchtime, she's like, you should probably take that. And then she says, it's a good thing I'm not your regular hematologist because I would be all over you if I saw this happening. And so sometimes we just need a reminder to stay on track, to stay on pace. And so we all need that. But I wanted to bring this to your attention as well, is that according to, there was a study that was done recently that found that preventative prophylaxis treatment for people with von Willebrand's disease. This is not a hemophilia study. This is not an inhibitor study. This is not any other type of study. This is a specific to von Willebrand's disease. And actually, by the way, in this study, I believe it was all types that were included in the study itself. It wasn't just one type. And this study found that it reduced annual bleed rates by 84%. 84%. That's huge. That could be seriously life changing. And so just being able to consider this idea of treating on a preventative treatment regimen, it could be the difference between you living a fulfilled and successful and full lifestyle versus not versus being disrupted all the time and a lot of unknowns. So let's talk about this a little bit. What are the benefits of being proactive? We are, as a staff, we always like to read a book together on leadership and different things. And I love Stephen Covey. You might have seen his material in the past, but 7 Habits of Highly Effective People, oldie but goodie. We're reading this again this year as a team. And one of the things that he says is that he says you have to embrace the idea that I am not a product of my circumstances, but I am a product of my decisions. And I think that he really elaborates on this idea of proactive nature versus reactive nature. So let's talk a little bit about the benefits of being proactive versus reactive, just in concept. So better control over your health outcomes. I think if you're proactive, you're taking preventative treatment, you will find that you will have better control over your long-term health outcomes. How does this apply to arthropathy? Obviously, it can severely minimize or even eliminate the progression of arthropathy getting to be crippling for sure. It also increases confidence. If you think about it and you're on a preventative treatment plan, you really have the opportunity to be able to maybe not worry so much about if you do this activity or that activity. If you go out on a picnic with your family, is it going to be disruptive? Are you going to find yourself having some sort of debilitating event that you would not ordinarily have if you had preventative treatment? So being on a preventative treatment regimen can increase confidence. Overall higher productivity. You can push the limits a little bit more if you know that you're covered, if you know that you have what you need on board to be able to face anything throughout your day. you can be have a higher level of productivity, meaning that you don't have to miss as many hours at work, or you don't have to leave earlier. Maybe you don't have to leave school, right? And then I think a big thing is less hospitalization, right? I mean, if you end up getting to the point where you're so depleted and you're having this crisis situation happen with a bleed, and you end up into the hospital, this is one way that sometimes it can even help to overcome formulary disputes. Sometimes the doctor may prescribe preventative treatment for you, and maybe your insurance doesn't approve the treatment for preventative treatment. Um, I think one of the ways that you can overcome that is to list how many hospitalization events you've had, to talk about avoiding hospitalization. Because I'll tell you, the one thing that insurance companies are the most afraid of is hospitalization. So, the cost is just enormous. It's far less expensive to treat people at home than it is to treat them in the hospital in an emergency scenario. So, keep that in mind. Less hospitalization is not just good for you, but it's also good for maybe the naysayers. So reactive. If you're reactive, you could have just the mental burden of the fear of interruption. So you could be in a scenario where you're just constantly taking up so much real estate in your mind. Maybe the mind of even being a parent for a child that has this, that you're just so consumed with, like, I got to I got to keep an eye on them like a hawk to make sure that they don't get have a bleed. And this is something that I think that just eliminating the fear of interruptions is worthy of trying to be proactive in some form or fashion. Long-term structural damage. Now, this is true with both joint bleeds, but it's also true with muscle bleeds. You can actually have degradation of the structural integrity of that area because have had a bleed. Every single time you have a bleed in an area, there is going to be some level of deterioration occurring. And so, if you can prevent it from happening on the front end, you can also prevent it from degrading the structural integrity of that area. Again, whether it's a muscle bleed or whether it is a joint bleed. Um, the exception of this may be, for instance, if you're having extended nosebleeds, there may not be long term structural damage, but it's still very disruptive. So, the thing I think that's important to remember is that if you're reactive, I had a muscle bleed as an example for me when I was a teenager, and it's never really fully recovered. One serious bleed can really degrade tissue in a way that's not it's irreversible. So you want to prevent that whenever possible. Another downside to being reactive versus proactive is that it can actually affect your motivation. It can affect your morale. You've probably seen this happen in your own self, or maybe your kid's self, or maybe your friend, or you're a caregiver for a neighbor or something like that. You may have experienced a situation where you've seen low motivation. One of the indicators, a lot of times, even we've done a lot of work on this within the mild hemophilia community, especially, and even women with bleeding disorders. You'll notice that when they're having any kind of bleeding activity going on in their body, that maybe the first indicator as a parent that they're having some sort of internal bleed is just that they feel really low energy. They feel like they don't want to go to school. Nobody wants to go to school at some point, but they're, they have this sense of like, people are like, want to go to Six Flags, and the kids are just like, oh. I mean, that seems like that would be a really fun thing. You want to go to the water park? Uh, you know, that could be an indication that there's some activity going on that could be an internal bleed. And so, I think the thing to think about with von Willebrand's disease in particular is that not every bleed is an external bleed. Sometimes it could be something also going on internally that you cannot see. And that is something you can prevent if you have preventative treatment. It maybe not completely prevent it, but you can at least interrupt it and slow it down. And again, being reactive in nature is something that could create a scenario where having hospitalizations is extremely disruptive to your family and to your workflow. So, what does this mean? We know it's better to be proactive. We know that it's important for us to try, if we can, if prophylaxis is available to you, and it's something that you want to ask for, it likely is going to require you to speak up. How do you get this preventative care? It starts with you. I think it's important to, we said it earlier, that there's an aspect of living with any kind of rare disease. And I'm going to classify. I believe we need to visit. I shared the numbers with you earlier about, how prominent von Willebrand's disease can be. But that doesn't necessarily, and so technically by the numbers, it might not be, if everyone was diagnosed, maybe it wouldn't be considered so rare. But I think you have to treat it as rare because there's only 30,000 people getting treatment right now, right? And so it's essentially a rare disease. And in that sense, I think it's incumbent upon us to be able to know as much as we possibly can, be well versed, and be able to speak up for what our needs are. We've got to be able to be educated enough to have an educated conversation about what we're going through, what is it that we're experiencing, and to be able to communicate that to our doctors. I was actually in a clinic visit recently with my daughter who has hemophilia, and in the conversation, her hematologist was saying, asking her some questions about what had she experienced, what had she been through, what were some of the things that she was experiencing. And it was just such a sweet moment, and I was so appreciative of the way that she handled my daughter. But she said something so simple but so profound. And she said, she said, you shouldn't have to speak up like this. You shouldn't have to advocate like this. You should be able to say, here's the symptoms, and the doctor should be able to say, yeah, that's what the solution is. Here's the solution. The doctor should be the one sort of like, that's our hope, right? And maybe one day it'll be that way. But she said something to my daughter. She said, you're gonna have to learn how to advocate for yourself. You're going to have to learn how to say the things that you don't want to say, how to talk about the uncomfortable stuff. You're going to have to talk about how many people that face adversity, this is common with people who face any type of adversity, a lot of times they begin to grow calluses to the point where they start to get, you hear people talk about this in pain management a lot, where they say that they have a high pain tolerance, right? And some of the reason why you form a high pain tolerance is because you've had so much pain. It's a survival mechanism really in our biology that beckons us to be able to grow tougher with more adversity. And so I think the important thing here is that people need to, you and I are going to need to get, yes, we have this sort of stamina that might be a little bit higher stamina than the average Joe, but we also need to be able to articulate sometimes the things that we take for granted as abnormal. Your greatest success with getting the treatment you need is going to be able to articulate with clarity to a treatment center or to a treater or to a professional or to a doctor, nurse, pharmacist, whoever, even insurance company. Your greatest strength to getting what you need and what your child needs is going to come from your ability to articulate what you may take for granted as your normal, because you only know what you know. But part of the reason why we do moments like this, we talk with other community members, we get engaged, is because if you realize, wait a minute, a 15-day menstrual cycle is just not normal. Like, heck, our Bivin von Allman, who I mentioned earlier, that did the podcast with us last year, talking about this issue for women specifically, he said, if you have longer than a 3-day menstrual cycle, you need to be suspicious that it's something's probably abnormal. Now, they say 3 to 5 days, 7 days, a little long. And really, volume is the issue there, as he articulated. It's not really just how long, but at the end of the day, and he gave this really great example of this in that podcast. But one of the things he brought up was, he said, if you're having more than 3 days, that's the point where you should start to go and say, maybe I should ask, maybe I should investigate this. The same is true for men and women about, if you have a bruise that just doesn't go away right away, if you have a nosebleed that lasts longer than an hour, I mean, if you have a nosebleed that lasts longer than 30 minutes, you probably should be thinking about, what do I need to investigate here? What questions should I be asking that are going to help me to get the best care possible? And so, again, I would just say that much of our progress is really not dependent upon how good the science is. It really starts with you and me. it starts with us being able to ask the right questions. Another little bonus material here. You may have toyed around or played around with AI at some point in your life. And I think one of the interesting things to me about, I don't know if you've seen ChatGPT or some of these other types of LLMs, but it's interesting to me that it is the best way to use those tools is by coming up with better questions. It really isn't about always having all the answers. This is a very Eastern mindset in education models as well. In ancient times, there was the people who had the greatest advancement in any educational model was who could ask more questions to take the topic to the next level. That was the highest good. And in our Western education, and really started even from sort of the Greek Roman education model, really started to become where there's a teacher at the front of the classroom that has all the answers, and when you're posed with a question, you have to present the correct answer. And actually, that's not the greatest form of education. The greatest model of education is who can ask the better question to take the conversation further. And so I find that this is kind of interesting and unique with ChatGPT and some of these models is like if you use some of these tools, like you're going to have to get good at asking better questions. There's all these people on social media that talk about the prompts, it's all the prompt game or whatever. Yeah, it's true. There's some truth in that, but it's true about our lives. It's true about your doctor. You're not going to get the results that you need unless you start asking better questions. You're not going to see better results in your life until you have the right questions that take the conversation further, not only to others, but also to yourself. And so I want to encourage you that asking questions and getting curious is really key to your success. So it starts with you and it starts with me. It starts with us. So what are some of those things? What are some of the things that we need to do? We need to self-educate. Now, I know I am preaching to the choir here because you guys are all here today because you're self-educating, all 86 of you. So I am super proud of all of you. So we've already got one of these things checked off on the list. Good job. You guys need to pat yourself on the back. You're doing great. The next thing is maybe be curious. Just get to the fact that you start to say curious. This arm is sore. Like I didn't lift that heavy of a box. I why is this arm so sore? Be curious and just start to think, is this connected to my bleeding disorder? Is this connected to maybe some other type of problem? I think the other thing, you guys are already doing that because you wouldn't be here if you weren't curious. So good job. See, we're checking off this list so fast. You guys are already halfway done. The last thing, or another thing I think that we're doing well, and that you're doing today is getting connected to community. These conversations, all of this conversation that's happening on in the chat, it is part of the journey of getting connected to community. The best learning oftentimes happens in the hallways. So getting connected to community is super important. You start to learn that it's not so abnormal after all. Maybe my abnormal is normal for the correct diagnosis or for the correct. Maybe I need a treatment plan that I didn't consider before. Maybe I need to go ask more questions to my doctor. Where do you get that from? A lot of times it comes from community. I think that journaling is a huge part of this. And so you might be doing this. I didn't check this one off yet because I don't know every person here if you're journaling or not. But it's a discipline for me. I'm not very good at it personally. So full confession time here. But I would encourage you, though. This is one way that even for my daughters that we were able to sort of get some progress was starting to keep track of where bleeds were. And I think that this is important for all of us to be able to say, okay, how do we really take the right tools? Because if you're going to an HTC, you're likely only going to have one annual visit per year. In some locations, you might be fortunate enough to have two or three. But if you have an annual visit and you've only got an hour, 2 hours with the physician, or maybe even with that, you're probably only getting 20 minutes with the physician at most. And so you got to prioritize. What are you going to talk about? Well, this data in the journal is going to get them the facts that they need to start investigating. So every time you have a bruise, and you circle it, take a photo, put it in your notes, write down, document like, yeah, I bumped my arm against the desk and it was just a real small bump. And now it's turned into a huge, okay, I started a nosebleed and it was just cold outside. Nothing was really significant there. So, those things are really important to journal and document. I think the other piece of this for all of us is to find the right medical partners. Think of it as a partnership. You need to find somebody that you can work with. And I love what Divin von Allman said in his podcast interview about if you don't get the information that you need, or if you don't feel like you're jiving with the person that you're talking to, get a second opinion. Get a third opinion. In his interview, I think he said, get a fourth, fifth, sixth, seventh opinion. Sometimes you need to continue down this path is just to get to a place to find the right person you can work with, and approach these questions in a way that they can also, I always say there's a difference between being an advocate and an activist. Sometimes those things, you can have somebody that's adversarial, like an activist, and and you can, you end up not being able to get what you need because you've been adversarial, because you're defensive. You've been told no so much, and that's trauma response. That is occasionally what we all experience at some levels, that when we're not getting the answers we need, we don't feel like we're being heard, we come into the conversation with a doctor with our dukes up. And sometimes that's not the best position for us to be in. Sometimes we need to attract more bees with honey than we can with vinegar. It is a really important place for you to be able to take the road of humility and to try to see if you can figure out how to partner with somebody, and think of it like a partnership. But keep going until you find the person you can work with. And then lastly, I think what you can do is define what success is for you. Define what is success for you. I think this is so important, because what is it that you want to do? What are your goals? What are some of your goals, that you want to achieve in life? Is it that you don't want disruption? You don't want to go to the hospital, and you don't want to be in the emergency room? What are those things? Well, a treatment plan may be the solution. A better treatment plan may be the solution to trying to help you achieve those goals. If you communicate those with your doctors that you're partnering with, a lot of times they may be able to help you to do that. So I think it's important. Asking the right questions in general should be a high priority for all of us. And I think these things will help us to be able to get to the right questions. How long did a bleeding episode last compared to my normal bleeding patterns? Should I be concerned about a bleed that lasted more than 15 minutes, from just a minor little nick or scratch? What point should I seek immediate medical attention for a bleed duration? These are questions that we should be thinking about ahead of time, and journaling this stuff, taking note of your own patterns. Um, you know, Asking questions to your provider like, should my factor levels be checked more regularly? Um, are there specific tests that I haven't taken that I should take? Thinking outside of the box a little bit may be able to help give you a better treatment plan. And it really starts with you and me. It starts with us getting to the right questions and getting the right partners and continuing to seek for progress. I want to talk about, just real briefly, I call this the cycle of success. I want to talk real briefly about this, because there's an emotional component to all of this journey for all of us, that we have to start with good ideas. We have to get into a mode of planning. We have to start to get to the point where we start to put this plan into motion and execute on that plan. And then guess what? This is the big doom and gloom. It's going to present roadblocks on your journey. You are going to get roadblocks on your journey. You're going to get to the doctor, and you're going to have this journal, and you're going to have these questions, and you're going to have all this material, and you're going to get up to bat, and you're going to ask the doctor, and maybe the doctor just is having a bad day, and he or she just doesn't listen to you the way that you expected. You were hoping for empathy, and you got arrogance. I mean, it happens. Maybe you walked into the clinic, though, and you were hoping for, a specific prophylaxis treatment regimen, and the only thing that they wanted to do was just monitor. That can be deflating, and that leads to discouragement. And so, what do you do when those roadblocks occur? I think you have to take a step back and have some reflection. I think you've got to make some adjustments to your plan. And when you go through these periods of saying, okay, what worked, what didn't work? Is it me? Is it them? Is it all of it? Is it just my attitude? I don't know what it is, but what is it that maybe I didn't go in? I have gone into clinic visits before without enough scientific data. Sometimes there was three options that they wanted to give me, and I wanted something else. And when I brought the something else up into the conversation, they were like, "Well, no, I think we're just going to stay with what we got." Well, in that conversation, if I would, I would go back and reapproach and go back and do my research again and go, no, 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 this really is, and here's the reasons why. If I went back with the clinical research and I appealed to my treatment center or to my doctors or to my care team with that data, it has changed the conversations at times. It really has. So you need to have reflection and adjustment when you find yourself in a place of discouragement, and then you need to reapproach. And sometimes it's really hard. I'll just be honest with you. Living with a rare disease and feeling like people don't understand is commonplace for us. It's commonplace for anyone living with a rare disease. It's commonplace for anyone living with an invisible disease. It's commonplace for anyone living with disability in general. And so you have to get some courage to reapproach the conversation even when it doesn't feel comfortable. You have to get the courage or else you're never going to have your best results. And so you've got to keep the goal at a focal point for you, or else you're never going to experience the last stage, which I call breakthrough. So this whole series of things is really just kind of a cycle. It's something that you start with, and then it just keeps rotating over and over and over again. And it's important, I believe, as individuals, that we really we find a way to encourage ourselves, and that can happen through moments like this, where you get to hang out with other fellow community members, where you're getting educated about what the latest and greatest technologies are, where you're getting information. But truly, if I think our position as an individual and as a person living with these things that are kind of trying to go through this rotation of success, this cycle of success, if you go from ideation to planning to execution to roadblocks, getting discouraged, reflecting on what happened, making adjustments, reapproaching, getting to a great breakthrough. I think the best fuel to keep you on the road of this cycle is just gratitude. It's having an attitude of gratitude. It's getting to the place where you can say, these are the things I'm grateful for. I'm grateful that I have a diagnosis. Maybe it's as simple as I'm grateful that treatment exists, even though I don't have the right treatment yet. But I'm going to keep pursuing that until I do. I'm grateful that there's another doctor I can talk to. I'm grateful that there's another moment where I can get together with my peers and my friends here at Hope, and I can cultivate a sense of community and ask them, how did they get to a place of treatment that they needed? Maybe I can get to the place of these types of things because whatever it is that helps you to adjust and reapproach, that's the only way you're going to get to breakthrough. That's the only way you're going to get to success. I would even say this about the technology itself. It is not all that uncommon that you may be on one kind of treatment for some period of time, and over time, it just doesn't work as well as it once upon a time did. There is plenty of stories. I mean, probably hundreds, if not thousands, of stories out there of desmopressin or DDAVP, where people, this is the first line of defense. People get this type of medication, and then they have such severe migraines that they can't even get out of bed. It's like, these side effects may not start right away, but they did start at some point, and so I think that the key to getting to the breakthrough is just to find a way to be grateful for what we have today, but also grateful that other potential progress exists. And that is how you get back to ideation, get back to the drawing board, get back to a place where you can get back to planning. And the biggest way to do that, the biggest way to I think, to stay engaged, just to remember that you're not in this by yourself. You're not. You're not alone in this. We are here. There is 84 people blowing up the chat in the chat box right now, talking with each other about being there for each other and supporting each other. There is so many resources and so many people and friends that you can link arms with to be able to help you through your health journey, so that you and your child or your family members can really have the best outcomes possible and reduce unnecessary suffering. If you feel like you're suffering, keep asking questions, keep pursuing the truth, keep trying. And if you've been discouraged, try something new. Try something you haven't tried yet. Ask more questions. Try to document as much as you can. And let's keep doing this together. Our best success is only going to come from the quality of the people that we spend time with. You know the old adage. My dad used to tell me this, and I've heard it for decades from all different sources. Is that if you show me your friends, I'll show you your future. And there's an element to all of this that I think is so important, that when we link arms together, we connect with each other, that we have the potential to be able to have better outcomes emotionally, mentally, and also physically when we really link arms with each other. So thank you all so much for listening to this today. Thank you for being here today. Thank you for being a